Hello, it's Tim Spector again of the Zoe COVID study, giving you this week's update. And we're going to be focusing a lot around whether we're going to be reaching this magical figure of 100,000 cases a day, which the government says would trigger some action by them, and why our data are consistently higher than the figures quoted by the government and the mainstream media. We'll be giving you some tips about how you can stay safe, and as always, putting the situation in the UK in the perspective of both of Europe and the rest of the world, both for diseases and also vaccines. So plenty to cover. So let's look at the very latest data from the Zoe app. So daily cases are still very high indeed, with a slight increase to nearly 93,000 cases per day, and 27,000 of those have been double vaccinated. That's around 29%, which is above that of last week. That means about 1 in 56 people across the UK have symptomatic COVID, probably more have asymptomatic disease that we can't pick up. And deaths, unfortunately, are up again slightly. Had a bad day just yesterday at 263 per day. But overall, it's around 1,000 deaths a week, which is slightly up on where we were. Hospitalizations only up slightly, but still high at around 916 people a day. And what has gone up is the number of people in intensive care on ventilators, which has gone up 15%. Now, these are high rates, and we would, if they continue at that rate, reach 100,000 cases by the end of the week. Although there are some signs that the last few days it has slowed down. Now, just to put this in perspective, we are in line with the government's own 2-weekly survey from the ONS, although we haven't seen their latest results. And these are the highest rates we've seen in the whole of 2021, including the January peaks. Now, the last few days, the increases have been just by a few thousand cases a day and haven't been leaping up quite as much. So hopefully we might be slowing down and be able to reach some sort of plateau, which would be great if that does happen. And media reports have suggested that this has already happened and things are on the way down. That's based purely on the confirmed cases, which we'll discuss a bit later about how accurate they are and whether we should totally rely on them, plus a bit of slightly optimistic modelling from some academic colleagues that people are using. So we'll have to wait and see really whether this slowdown actually ends up in being a peak, because we have been fooled in the past with this. So let's just have a bit of discussion about why our rates are so different to those that are quoted routinely by the government and repeated by the mainstream media as the real state of what's going on. As you can see in the graph, we have consistently been getting higher levels from the Zoe app, from your reporting, than from the confirmed cases. And this is understandable because we get results from people who've reported any symptom. We have a list of over 25 symptoms, and we make it freely available, whereas the government often only test people who have the classic symptoms, which is less than 50% of the current number of cases. And we know that's outdated. And we think they're basically not testing the right people while we do. They do include some asymptomatic cases, and that is where a lot of the hundreds of thousands of tests done every day are going, but they're not a large proportion as far as we can tell. So although we're testing a smaller sample of the population, as we can't invite everyone in the UK, we use statistics to extrapolate these figures to the UK population, adjusting for differences in age, in sex, in areas of deprivation, all the things that we know affect how these tests impact. So the other reason that our data can be higher than the official statistics are that people aren't now reporting lateral flow tests that are positive back to the government, and there's no way that they can really check on this, and just relying on goodwill. And this could be why many cases are being missed, as well as the problem of picking the wrong symptoms. But if you're on the Zoe app, you can log both your lateral flow tests and your PCR tests in our app, and that means we get all the positive cases gathered together. And these wouldn't be logged normally by the government. So as you can see from the graphs, generally we have a similar pattern, but the absolute numbers are different. And if you want an optimistic view of the state of the pandemic, you take the government figures. If you want a more pragmatic, realistic view of what's really happening, you take the Zoe figures or the ONS data when they do come out every 2 weeks. So whilst we hope that rates are either slowing or be great if they've come down, I think it's too early to say and make any real decisions based on that. Let's now look at age groups. So the small decline we saw a couple of weeks ago in school-age children has petered out. We've got a slight rise in the last few days, although it doesn't look particularly strong and maybe leveling off. And 50% of cases still remain in generally the younger age groups. But as you can see from the graph, all the age categories are now increasing. And particularly worrying is the over 40s and over 50s, which is most obvious and will start to be having an impact. Only a very slight increase so far in the over 60s, so that hasn't taken off, and that's the group that's been most well vaccinated, so that's good news. Now let's look at regional breakdowns, and really we're seeing a fairly uniform picture compared to some things in the past, a rise around the country. Both England, Scotland and Wales all going up in terms of numbers of new cases, some areas faster than others. So generally we are able to cope with this. It doesn't mean it's a good situation, but it is not overwhelming, although within some of these areas there are problems. And we talked about the big increases in the southwest of the country that had those problems of fraud with the PCR testing affecting many of those areas, and obviously get a lot influx of tourists, etc. at this time of year. Those increases have been the fastest in the last 6 months. Have an R value that was 1.3 last week is now 1.2, easing a bit, but the Royal Cornwall Hospital did declare a critical incident due to its sheer volume of patients and did close for a couple of days. So do have to think whether there are these local areas and local problems that we need to consider, particularly when we're rather complacent about even telling people they have to wear masks. That would reduce this by a small percent. Scotland and Wales, interestingly, when you look at these, are not doing as well as perhaps they should be, given that they've got increased restrictions compared to England. But it could be these restrictions are not enforced enough or haven't had time to bite. And I think a lot of the point of the vaccine passport is to really get the overall vaccination rate up. And although they're above 71%, they're above the English rates. They're not in the sort of league that we're seeing in other countries that make a big difference. So if the government is unkeen to enforce any of these restrictions, there are some things that we can do as individuals that will have an impact. And with these high numbers of cases around, people will naturally start to worry about themselves and their family more. So here are my top tips. Wear a mask in crowded and poorly ventilated areas. Minimize your attendance at crowded indoor gatherings. And if you're not well, do stay at home and take a lateral flow test and log it in the app. And remember that lateral flow tests are still freely available in chemists, or you can order them online from the government. And they are something that we should be using more of. Do get your booster jab or your second vaccination if you haven't done already. This is really powerful medicine. And then log it in the app. And then do spread the word about the COVID study and realize that we can bring you the best data. So get other people to use it as well, improves education about the disease. So let's talk briefly about boosters. About 170,000 of you Zoe users have logged your boosters so far. And a question, if you are waiting or you've had it, do log it on the app. It will give you an increased level of protection above that of having 2 vaccines, which we know are waning, those effects after 6 months, whether it's the Pfizer, whether it's the AstraZeneca. And I think this is really important, particularly as we head into flu season. Who can get one? At the current rules, it's anyone over 50, anyone who's been vaxxed over 6 months ago, healthcare workers, and those who are immunosuppressed, etc. And we are getting official data that about 1 million people a week are getting the booster, which sounds fantastic, but unfortunately that there are about 2 million people a week who are becoming eligible, because we were doing so much vaccination in the early part of the year that we're finding hard to keep up with. So that number is getting worse. So it's a bit of a stretch for the NHS at the moment to get those done. Do let us know about any regional problems in the comments below. Did your local hospital run out, as we're hearing from some places? I'm also interested to hear whether anyone has been reinfected after having 2 vaccines and a booster. I've not heard of anyone, and certainly not hearing any reports from the medical staff who were one of the first to get vaccinated and have the boosters, which is a great sign. Certainly no really bad stories of deaths that we were hearing earlier in the year, which is good news. So let's move on to how the UK is doing internationally and look at some maps on this. And if we first look globally, we can see that really UK and parts of Eastern Europe are doing rather badly compared to the rest of the world in terms of confirmed cases. And if we zoom in on Europe, we can see that the darker the colour, that's the higher the rates we're getting. And the UK, including Northern Ireland, is very dark red, and which is only one step back from the very worst countries affected in the world, where we're seeing places like Romania, Latvia, and a lot of those Central and Eastern European countries, ex-Soviet bloc countries, who are doing really badly. And the difference is that although we have similar rates of infection, most of those countries have very low rates of vaccination, and that means that hospitalizations are much lower. And that's one of the bits of good news that we have, that we're running much lower rates of hospital admissions compared to those countries who are really anti-vax in their mentality, and they have a general mistrust of the governments, even more than we do. And if you look at in more detail the hospital admissions per million people, so this is relative to the size of each of the countries, we can see Romania really in a very bad way, with huge numbers of hospital admissions overrunning their healthcare system. Latvia's increasing fast and looks set to be at those high levels. Then you've got the other countries like Croatia, Slovenia, with the UK really not far behind those ones. And we're really ahead of the pack in Western Europe, showing that it's not just vaccinations that are important. And again, as we've been showing, that the countries doing best are France, Italy, Spain, Portugal, and the Scandinavian countries on this. And if we look now at the vaccine rates internationally, but focusing on Europe, make it more manageable, we can see that the UK is still only 66.8% double vaccinated, increasing at a really slow rate now, glacial speed, compared to many other countries which are still surging ahead. And the government insists on painting a rosy picture, saying this is about 84%, because it only counts adults or older teenagers in that percentage. But COVID doesn't respect those boundaries, and that's why we do need to talk about the whole population, because it can affect everybody from babies to centenarians. And we can see here how Portugal's still going up. 87% is what they're recording. They should be seeing herd immunity kicking in there now, and really potentially eradicating COVID. Obviously, you need to get these rates down before winter, but it shows the links between vaccination and hospitalizations and cases quite nicely. Now, we showed this graph last week of visualization of risk, and I think it clearly shows how important vaccination is, protecting yourself. On the left side, you've got previous infections. If you've been previously infected, as many of us have, you get a head start, really. 65% protection up to 12 months, which is pretty good, which is about a threefold reduction in risk of having it a second time. But that's massively increased if you get one of the two vaccinations, at taking you over tenfold improved risk. Now, if you've not had a previous infection, or you don't know you have, you get a 71% protection with an AstraZeneca vaccine at about 6 months, and about 83% Pfizer. So that equates to about a 4 to 5-fold reduced risk, which is still pretty good. Now, we want to collect this information on boosters, because we think it's going to be around the 95% mark, about a 20-fold reduction. So just showing how important it is, and hopefully we'll be able to add to that chart soon. And remember, you can get reinfected after infection. Many of the British public don't think that's possible when you ask them. And they also don't think it's possible after being double vaccinated. But we've found 458 users reinfected since Delta came to the UK, and 21,000 users who were infected previously. So that's about 2%. 1 in 50 people are getting reinfected, which is similar to some of the other surveys that have been coming out. Now, remember, reinfection is possible, so do think about those symptoms and getting a lateral flow test. And again, logging anything that comes up is really important. So finally, back to symptoms again. We've been telling you, the public, and hopefully you've been spreading the word about the changing symptoms for nearly 600 days now. Sadly, the government's not listening. The branch of the government that is responsible is what was called Public Health England, is now called HSA UK, led by Dr. Jenny Harries and Dr. Susan Hopkins. And it's really up to those two to make this decision about why they won't tell the population about the top 5 symptoms that there are at the moment. These are identical for children and people who have been double vaccinated. And in this real world scenario, fever is no longer there. It's down at number 8. Loss of smell and taste is down at number 6. And we've got these old ones again. It's the headache, the runny nose, sneezing, sore throat, and cough. And so we really do need everyone aware of this, and we would be reducing the number of cases, number of deaths, if this was common knowledge. And that's why the government is facing an optimistic picture of the actual real numbers of cases. So to sum up, cases are still rising. Whether or not they hit 100,000 a day is unclear at the moment. It'd be great if it does plateau off and drop before then. And we'll have to wait and see if that is the case. But I think we have the power to change that trajectory by realizing that we're, compared to other countries, we are in a really bad place, and that a proportion of these cases is ending up in hospital and causing around 50,000 deaths a year, which is not something that's trivial. At the same time, I think we have to realize that whilst some areas of the country will have a hospital that is experiencing problems, generally the regions are at levels of 6 to 8%, which are not overwhelming those regions that have the capacity. But long term, this will have a really bad effect on the rest of the health system that is still trying to get back this massive backlog of cases. And having 10% of your hospital full of COVID cases is not a really good way to run an efficient healthcare system. So we need to get back to the level that other countries are enjoying, and that means community efforts and just changing some of our habits without costing the earth. So the picture is still much the same. Let's hope next week I can report that these figures have peaked and are going down. Do subscribe to this channel, spread the word about symptoms, and keep logging and stay safe. Thank you.